Let's learn the characteristics of dengue fever. It is a severe, flu-like illness that affects infants, young children and adults, but seldom causes death. Dengue should be suspected when a high fever, 40 degrees Celsius, 104 degrees Fahrenheit, is accompanied by two of the following symptoms: severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands or rash. Symptoms usually last for 2 to 7 days, after an incubation period of 4 to 10 days after the bite from an infected mosquito. Script taken from World Health Organization. All clips may not represent the story. Watch to become bilingual, as the video is specially made for English learners. Severe dengue is a potentially deadly complication due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Warning signs occur 3 to 7 days after the first symptoms in conjunction with a decrease in temperature below 38 degrees Celsius, 100 degrees Fahrenheit, and include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, restlessness and blood in vomit. The next 24 to 48 hours of the critical stage can be lethal. Proper medical care is needed to avoid complications and risk of death. Treatment: there is no specific treatment for dengue fever. For severe dengue, medical care by physicians and nurses experienced with the effects and progression of the disease can save lives, decreasing mortality rates from more than 20% to less than 1%. Maintenance of the patient's body fluid volume is critical to severe dengue care. Immunization. The first dengue vaccine, Dengvaxia (TDV), developed by Sanofi Pasteur, was licensed in December 2015 and has now been approved by regulatory authorities in 20 countries for use in endemic areas in persons ranging from 9 to 45 years of age. In April 2016, WHO issued a conditional recommendation on the use of the vaccine for areas in which dengue is highly endemic, as defined by seroprevalence of 70% or higher. In November 2017, the results of an additional analysis to retrospectively determine serostatus at the time of vaccination were released. The analysis showed that the subset of trial participants who were inferred to be seronegative at time of first vaccination had a higher risk of more severe dengue and hospitalizations from dengue compared to unvaccinated participants. WHO position the live attenuated dengue vaccine TDV has been shown in clinical trials to be efficacious and safe in persons who have had a previous dengue virus infection, seropositive individuals, but carries an increased risk of severe dengue in those who experience their first natural dengue infection after vaccination, seronegative individuals. For countries considering vaccination as part of their dengue control program, pre-vaccination screening is the recommended strategy. With this strategy, only persons with evidence of a past dengue infection would be vaccinated based on an antibody test, or on a documented laboratory-confirmed dengue infection in the past. Decisions about implementing a pre-vaccination screening strategy will require careful assessment at the country level, including consideration of the sensitivity and specificity of available tests and of local priorities, dengue epidemiology, country-specific dengue hospitalization rates, and affordability of both TDV and screening tests. Vaccination should be considered as part of an integrated dengue prevention and control strategy. There is an ongoing need to adhere to other disease preventive measures such as well-executed and sustained vector control. Individuals, whether vaccinated or not, should seek prompt medical care if dengue-like symptoms occur. Prevention and control. At present, the main method to control or prevent the transmission of dengue virus is to combat vector mosquitoes through preventing mosquitoes from accessing egg-laying habitats by environmental management and modification, disposing of solid waste properly and removing artificial man-made habitats, covering, emptying and cleaning of domestic water storage containers on a weekly basis, applying appropriate insecticides to water storage outdoor containers, using of personal household protection measures, such as window screens, long-sleeved clothes, repellents, insecticide-treated materials, coils and vaporizers. These measures have to be observed during the day both at home and place of work, since the mosquito bites during the day, improving community participation and mobilization for sustained vector control, applying insecticides as space spraying during outbreaks as one of the emergency vector control measures. Active monitoring and surveillance of vectors should be carried out to determine effectiveness of control interventions. Careful clinical detection and management of dengue patients can significantly reduce mortality rates from severe dengue. Global Strategy for Dengue Prevention and Control, 2012 to 2020, Chapter 2. Who responds to dengue in the following ways. Supports countries in the confirmation of outbreaks through its collaborating network of laboratories, provides technical support and guidance to countries for the effective management of dengue outbreaks, supports countries to improve their reporting systems and capture the true burden of the disease, provides training on clinical management, diagnosis and vector control at the regional level with some of its collaborating centers, formulates evidence-based strategies and policies, develops new tools, including insecticide products and application technologies, gathers official records of dengue and severe dengue from over 100 member states, and publishes guidelines and handbooks for surveillance, case management, diagnosis, dengue prevention and control for member states. Contributed by Bart S., Gething P.W., Brady O.J., Messina J.P., Farlow Orr, Moyes C.L. and Brady O.J., Gething P.W., Bart S., Messina J.P., Brownstein J.S., Hohenag. Please subscribe to my channel. Thanks for watching.